mercy fall on me. Everyone needs forgiveness, the kindness of the Savior, the hope of nations. Savior.
This is Chariot.
Hi, lovely people. Welcome to Action Time. My name is Dr. Stepby. Today I'm here because it's the time for us to again kickstart our program called Action Time. And you may be asking, what exactly is Action Time? Action Time is a space for Christian youth and young adults to come together to learn about things concerning spiritual growth, to learn about things concerning health and wealth, and also to learn about things concerning social life. So today we're going to be kickstarting off our program with a subject around health and wellness, but specifically something around sickle cell disease. Now, did you know that September is a month for sickle cell awareness? If you didn't know, today we're going to be discussing things. And the topic of choice today is uncovering sickle cell disease and sickle cell trait. Now, I have an expert with me today. He's a colleague of mine. I've known him for about 3 years now, and he is the founder and CEO of No One Behind Foundation, and also director and research and partnership for Sickle Cell 101. His name is Dr. Stephen Bote, and I'd like to have him up on the screen. And I'm going to ask him a couple of questions as to what exactly sickle cell is about. On a fun side, too, aside from being a doctor, he's also a Manchester United fan. But as you can see my background, I'm a Chelsea fan. So we have this little banter between us two. So how are you feeling today? I know you have a lot to say about my
I
team's
feel I feel
performance.
really good today. I feel really good. I think I should change my name to Ilanga today because it made my day. But no, it's great. It's great to be here. I'm just super excited. I think for anybody that knows me, anything that has to do with sickle cell disease or sickle cell trait, I love talking about it because I know it's important in our community, and I'm just glad to be here. So thank you all for having me today.
It's our pleasure. As in my introduction, I made mention about Sickle Cell Awareness Month and Sickle Cell Awareness Day, or what exactly it is. Could you elaborate a little bit more as to what exactly Sickle Cell Awareness Month is? And then we'll get into our topic for discussion for today.
Yeah, 100%. So for those of you that do not know, just like Dr. Ajari just said, September is Sickle Cell Awareness Month. Now, what I can share with you is that usually it's not talked about as often, right? I'll bet you that if you probably walked out right now or you texted people and friends and said, hey, did you know September is Sickle Cell Awareness Month? Most people wouldn't know. And that is exactly why we're here doing it and having this important topic. The main reason why September is important to talk about sickle cell disease and sickle cell trait is that really focusing on understanding where this disease it came from, the
Mhm.
current people that are impacted, which is I'll talk more about in a few, mostly people that are from Black or African descent. But even more importantly, let's look at where we are with sickle cell disease now. For people that live with the disease, what is currently being used to help them manage that disease, and then for people that have just sickle cell trait, what do we know so far? It's really aimed at building more awareness, education, but most importantly, to advocating for improved funding and research for sickle cell. So I think that the goal is just keep improving the awareness around. That's why this month is dedicated to it. I
Mhm.
will say probably, June, which is typically June 19 is usually World Sickle Cell Days when you tend to hear a lot more about sickle cell disease. But the goal is not just in June. People living with sickle cell are impacted by every single day. But we dedicate this month to just embolden their stories and also help improve the overall advocacy for the disease and trait.
Awesome. So thanks for highlighting that. So we're now going to go to our topic for the day, which is uncovering sickle cell disease and sickle cell trait and why we should care. So could you start off by telling us exactly what is sickle cell disease and how it's diagnosed?
Yeah. This is probably my favorite question to dig into. So I am a storyteller, right? So it's a part of me as a trainer. I like to really give the historical context to it. So the first thing I like to think about sickle cell disease is that I
Mhm.
want us to all think about, for every human being, right? When you're born, take sickle cell out of the realm. both of your parents, you're going to inherit various genes from both those parents, right?
Correct.
And so those genes is what's going to help determine your eye color, your hair color, a lot of the things that make up who you are, right? So most of these genes that we talk about that makes up who we are, we're inheriting one of each from each biological parent, right?
Correct.
So you're probably like wondering, why am I talking about that? And so the same way that you inherit genes to determine your all the things that I talked about, eye, hair color, you name it, your skin color, you name it, is the same way that every individual, every single person inherits a gene that's going to determine how our blood is going to work,
Hmm.
right? So before I dive into sickle cell, now what usually happens is that people are typically going to inherit one gene from one mom, from the mom, one gene from the dad, and that's going to determine how our red blood cells are going to function. So for
Hmm.
people that do not have sickle cell disease or sickle cell trait, here's what happens. So there's some numbers and some letters I'm going to use, but just stay with me on this, right? So the most common and the typical hemoglobin or red blood cell kind of component in terms of a genetic standpoint is called hemoglobin A. Now, A is what most people typically get. I call it the typical hemoglobin, right? So if your mother gives you hemoglobin A and your dad gives you a hemoglobin A gene, now
Hmm.
you have the typical hemoglobin. So that's when you tend to hear people say, I am AA, right? So hemoglobin AA. That's people very typical. That's what's typically most common. Now, I want to dig in and talk about why that is important. Those genes that you inherit from your parents is going to determine the shape of your red blood cells and how they're able to transport oxygen throughout your body. Right, a known fact from a biological standpoint is as we're sitting doing everything every single day, you need your red blood cells to transport oxygen and nutrients throughout your body. Takes it to your organs, your tissues, you name it. That's how you're able to function every day. So you need those red blood cells to work. Now, typically for people that are AA,
Hmm.
your red blood cells will last about 120 days, right? And your body will make new ones. And so, someone is AA, their red blood cells are very typical. They're round, squishy. They can go through vessels and get to all the different parts of our body to take oxygen there, and everything is fine, right? That is very typical. Again, you got this from your parents. I share that perspective from people that have the typical hemoglobin just to re-emphasize the fact that most of the time, especially in our culture, people have a misconception that sickle cell might be a curse or it might be an abomination or something that someone got. It is not. So think about how I've described the typical hemoglobin AA, right?
Hmm.
Some may think AA, one from each parent. That is what's common, most very typical. Lasts about 120 days, and those red blood cells will regenerate. Now, keep that, stash that somewhere. Next place I want to go is that you're gonna have some people, there's some individuals that have one hemoglobin A and one hemoglobin S, right? So the S is the sickle cell hemoglobin that or the sickle cell gene that we're going to dive into. So if you have one person that has hemoglobin A and hemoglobin S, that is typically referred to as someone being a carrier or sometimes called sickle cell trait, right? So people like that, most of the time and almost all the time, they are also equally able to transport oxygen, just like I described people with AA. It's very common most of the time. Now, we do know from research that I do, a lot of researchers do that there's a lot of evolving research that shows that for people that have hemoglobin AS,
Hmm.
under some conditions, they might get some complications. It is very, very rare. But I think general fact, think about AS, sickle cell trait. Those are people that they inherit one copy A from one of the parents and then an
Right.
S from another parent. And that's how they have AS. Typically, okay, everything goes just as fine. Now we're going to go to the next step, right? So three phases, people with sickle cell. And now the most common one is people that have SS, right? So the same way people inherit those genes that tells how our hemoglobins work, they have a person that has a hemoglobin S from one parent and hemoglobin S from another parent, and they inherit that. Now they have SS. That is sickle cell disease. Now I want to highlight and remind people these are the most common. They are
Hmm.
very there's hemoglobin SC. Even in sickle cell trait, there's other variants, but these are the typical hemoglobin, right? And so, to kind of summarize the definition, when you think of most people will have hemoglobin AA, They inherited both of those things from their parents, right?
Mm-hmm.
People that have AS, typically referred to as sickle cell trait, also inherited one A from one parent and the other S from the other parent, whichever way it might be. You have SS, which is sickle cell disease, most common, inheriting an S from a parent and another S from another parent, and that is where sickle cell disease comes from. That is where I want to start and kind of think about the foundational definition and understanding of what sickle cell is. And in terms of diagnosis, most of the time, it's diagnosed through newborn screening. Like you think about our community in Ghana, newborn screening is not that common. So
Mm-hmm.
most people walk around, they have no clue that they have sickle cell trait, and that is because newborn screenings are not widely available. Like even here in the U.S., only up until the early 2000s is when newborn screenings became available across all states. And I'm sure you can tell me there's somebody who was born before the 2000s that you know.
Yes.
So think about that health disparity I talk a lot about. That's why this is important. So a lot of people don't know they have the trait. And like I said, the trait typically they don't have any complications. And one thing I can share with you is that most people will only find out they have sickle cell trait after they have a child born with sickle cell disease. Like I said, they give that gene to the kid. And if the other partner is also AS, that's how they'll get the disease too. So that's how it's diagnosed. Newborn screening, there's different point of care testing. There's a lot of evolving tests as well. There's genetic testing that can help determine it. But in our culture, if you don't have newborn screening, it can be expensive if you want to go find out later on. So that is how I'll summarize sickle cell disease
Mm-hmm.
and how it's diagnosed. And hopefully it gives context to the fact that it is not a curse. That myth is not true. It's just something we inherit from our parents, just like our hair color, eye color, skin color, anything else.
Right. I appreciate you defining what exactly sickle cell is and also how to diagnose. And I'm gonna try to like interchange between languages so that our audience are aware and kind of like engage with the conversation that we're having. And to me, follow-up question, person bisa on the say can't sickle cell trait and the difference in the sickle cell disease and then they will like the same and not say different.
That's a good question. And see, the way I'm investing me break it and also down and say, so to your point, to senior kind, most people confuse sickle cell disease and the sickle cell trait. Those two things are very different, right? And so be a sickle cell disease, I'm gonna unfortunately most of the time I'm gonna deal with those complications that come with sickle cell disease. And I'm going to talk a lot about those complications, right? And so who will be our sickle cell disease? Then those complications, and then they said earlier. It's all about umoja, the umoja, right? And to say umoja and nam nipa ni and to me for oxygen, any nutrients, and cop every part of nipa body here, and leading to complications. Pain is the most common one. Strokes, anemia, you name it. I could go on. Acute chest syndrome. And to people with sickle cell disease, those are complications of mutania, mainly because more red blood cells into mean transported oxygen and nutrients as fast and as effective to say the obi or AS and also obi or AA, right?
Mm-hmm.
Now, I did back me best my point is say so shit different between sickle cell disease and sickle cell trait. Best my history lesson get to be more
Sure.
right?
We'll find out.
So you probably baby say and then I did you can sickle cell most of the time. You see before you right? You can sickle cell is and na yen kwana impact here. It is true, right? And the fact is that this is the fact. OBI, irrespective of race or ethnicity, baby are free, your gender, everybody on this earth can have sickle cell disease or even sickle cell trait. That is a known fact. Meaning abroad for more sickle cell disease. Meaning Hispanics are more sickle cell. But those people are not as much as people are more to say minnow, right? And so the key fact is sickle cell disease or sickle cell trait, it disproportionately affected people are almost free Black or African region. You're probably like, nah, dang, and a young quiet side. It's my young boy.
Yeah,
Right. So there's a young quiet. It didn't have right. So for me the way I'm when say, here say it to me history tia say send you do is free by and again walk with me. Right. So the known fact is that sickle cell it evolved to protect against malaria. That disease came from regions and parts of the world that malaria is common. So what to say me, no what's not Ghana that I'm sure it's when you're malaria that. It be always on malaria and sickle cell do for him fine. And I love talking about this topic. So let me give a brief overview. As we all know, so into me starting na me can about moja ho asem, right? Into say udwen nipa nyina udwen fan say be opera na unya moja a drop sisi ya. So first our moja now shit under microscope. The obehun said you're going to see these little cells, right? Those little cells, a circle shape, and then your top friend of red blood cells, right? And telling me earlier, obia only sickle cell or more red blood cells, a round, right? Oh, shess our red blood cells in mua. Yobehunu said there's all of these nutrients. So one of the key things in there is a protein, your friend hemoglobin. Hemoglobin, no. The idea you say in the tintin in TTM1 is a hemoglobin share red blood cells. And the bois etching oxygen at the kobebi here. And this a red blood cells nina mumuna a kobebi equa. Hemoglobin watch oxygen at tiny home. A change so do baby here and zebia or liver or heart or lung or nine, whatever that is, right? So hemoglobin in bois, so I know a deposit oxygen. No, could be for forever. That's how it works. So you think blood, you think in the blood, there's red blood cells. In the red blood cells, there's these hemoglobin and all these proteins signed to be transporting oxygen, right? Into a metre musa and say, so during malaria and tuntum, then and tuntum moja, right? They love blood. So if you're I may be the scientist in me. I think the concept of sickle cell is very fascinating. So the way I didn't need to start here and say most people had hemoglobin A na earlier. Now our body started to realize that this evolutionary story I'm giving you, our body started to realize malaria is common and it keeps affecting us. The more they are feeding on the oxygen and the nutrients, right? So let me share. So now be red blood cells on the nutrients and then hemoglobin BBL. Those are the things that the malaria parasites love. Plasmodium and normal pet. No. Malaria no infectua, which is the most common Plasmodium falciparum, right? And I'll not bore you all with that. Or infectua or comodium no pet nutrients. And so I know the enough for munina. That's how obey yai and you get so sick. Today, what the decided to obey and said, okay. Send me chair earlier. And with genes, a woman in a chair, send your obinya moja, send your obinya moja besia, right? So what is what do you say me change gene kakra in such a way, say? Then me to me okay, be a cause of fine. But me change gene kakra be in such a way, say malaria be an answer and tuntum be kamia. Then tuntum per se or dini juma, the be seen in the say. Me mojano, memmano. I'm going to call it superpower. I'm going to give it this machinery a bit to me. I can say, and then call it the mesicle and sickle, and then say it's going to break apart, it's going to stretch and release all the things that are in there, or it's not going to be transparent as efficient, right? And see, our body is like, hey, I'm going to provide this mechanism where if I get infected with malaria, my blood, time a red blood cell, a bit to me sickle, no, to them kind of break you apart, and they break you apart, and then nutrients in every month. Malaria parasites, only baby and it's going to die. Right? So that was our body's way of saying, I'm going to outsmart this malaria so that when I'm sitting there, I'm doing okay. When malaria presents, it presents a mild body and it puts your body through extreme conditions, right? So you're going to have high temperatures and all of these stressful environment in your body. Your body recognizes that those genes will have the capacity to say, I'm going to sickle. So I switch that happening and then they don't conform what sickle cell trait. Right, to be a sickle cell trait, that's what you see is that most people, it's not all, because there's other factors to that can impact the severity of malaria. Most people are more sickle cell trait, or more malaria, and say that affect you more symptoms that are severe compared to most other people. So that is where this whole thing came from, right? Just our body's own way of saying, I'm going to outsmart this malaria. And of course, very common, maybe are you free. Now, the follow-up effect of that is, you see, genes you change. I'm a nipa be in your AS, right? So they can have that ability. Now, so nipa 2 in your AS. Now, if you say, oh, me call me back, right? Just like I shared earlier. But if you instead of a woman about Nibana S, Bema S, no ban some money ban so S. That is SS. that is sickle cell disease, right? In the size, that is mainly the main difference, right? You have people with
Mhm.
AS that are me S no to omunya sickle cell disease. So that's the clear difference, and I think it's important that OBOT Adewe started in regions that malaria are common. Even if you go to India, South America, a lot of these places, to be home for most what sickle cell disease and sickle cell traits. And so, send me no and if you look at it globally in the world right now, now sickle cell and kasa it's actually the most common hemoglobin mutation. People don't know it's common in the world. And the sad truth is that, like I said earlier, most people don't know because sickle cell traits, most people who experience symptoms behind they haven't been tested, they don't know, and most of them will find out or more on the banana sickle cell disease because disease is only very severe. And I'm going to give you a little bit more detail about some of those. So that's kind of the clear difference between the two, and I think it's important that we acknowledge it. I always say sickle cell is part of Black history, and the more we
Mhm.
acknowledge it, we can be more equipped to manage and treat it and improve testing. So that's what I would say.
Got it. Into no summit tawasia sickle cell trait no enya yare.
No.
Okay, into say sickle cell enya yare, sickle cell traits nankasa enya yare.
Hmm.
I need to know yeah testing. Like, does it even matter? Like, why should I
Yeah.
worry about it? Because something yare won't be okay.
That's a good question. For me, there's two reasons why I think cells will be tested. The
Mhm.
first one is because so was sickle cell trait. Now, person what? Ultimately passes our genes on to ma. Ubetumi a
Mhm.
oba no so nya sickle cell trait say what? And now ubetumi a oba onye mu bia. Ba ubetumi so oba no nya sickle cell disease. Into when breaking numbers down. So you what parents mean oba bema, right? Now, so meaning now AS as I'm saying this is the most common, right? So let's do AS for example. I like to kind of think of analogy. There's a 25% chance
Fun and
with
square.
every pregnancy, 25% chance. Every time their parents know me no more sickle cell training, because you perceive
Mhm.
25% chance or mobano, ebenya sickle cell disease. Between S number, not disease. So that's why it's important. There's a 50% chance. So our parents mean, some person what? Baby to mean sickle cell traits to solve more. So
Mhm.
they can A and an S. And then you have the other 25% chance of them having a child that are kind of be A. They said you're only and they usually have the typical hemoglobin. So these are the chances, and that's why it's important. Meaning the way I kind of say people shouldn't be told. That's my opinion. I don't think I have any right to tell someone to have or not have a kid. I
True.
think the goal is that people should be given informed decisions to resource to make informed decisions. And I'll give you
Mhm.
a quick example. I used to work at St. Jude Children's Research Hospital, one of the biggest hospitals known in the world, and then one of the biggest in the do hematology. And we saw several cases of parents them and to come back because hey now we now catch him say me know why is say you buy a sickle cell disease. Now me will be with him for only. And so that is why I think it's important that people get tested. And I have a lot of people that will send me messages about it. And there's a woman who send message on Instagram with our sickle cell near my AF for sickle cell 101. And the mom will
Mhm.
channel. You can check out sickle cell 101 on all our social media platforms. The woman looked at our resource and catch him and said, or nephew, the nephew just got born. They found a nephew has sickle cell disease. Or no phobia, they had no clue. So that is why to answer your question is important, I think, to people to know and stay informed. The second part, I think that we see a lot of it here in the US and a lot of advanced countries, a lot of evolving research that shows that or more sickle cell traits and the certain triggers, high altitude, increased pressure in the atmosphere, severe dehydration, sang almost sickle cell traits, they can actually sickle. Say them see malaria adenumuna. Or to me sickle sometimes no on complications. If you know there's something called rhabdomyolysis. Dr. Jaibi
Mhm.
to me severe muscle breakdown. They can have eye complications. If you don't to mean blood in their urine. And there's actually another fact. There's a kidney cancer. There's a rare kidney cancer called renal medullary carcinoma. Over 90% of people that are more cancer and more sickle cell trait. So these things are not common, they're rare, but it's happening. I know last year I love American football. Last year I American football. Now Denver Broncos, one of their top running backs to win the Super Bowl. Almost yo, Akonenya renal medullary carcinoma, healthy athlete, and he died in a couple of days, and it happened so fast. And it's sickle cell trait, like I said, is a big correlation there. And there's severe stories about that athletes be bring summertime, more exercise, dehydration, and then they'll pass out. So these things I want to tell people, it's not happening in everybody. It is rare, but it does happen. And so that is why I think it's important that people know their trait status. This is the analogy I want everybody to think about. Me who say knowing your genotype, knowing your sickle cell trait status. As I said, the old driving car with your seatbelt.
Mm-hmm.
I'm pretty sure we all can agree that probably over 99% of the time, seatbelts don't walk around, it has no benefit, right? It's just a truth. But it doesn't stop us from not wearing the seatbelt, because in that one instance, maybe and you get in an accident, that seatbelt could be life-saving. So to me, knowing your sickle cell trait status is just similar to that. It's knowing your trait status, it be about 25% chance, and you're going to be fine. But it could be that one instance the kid will have sickle cell disease. And if they do, at least you're prepared if you want to make that decision and you know what the treatments look like. They'll be out in a resource being on more and kind of more, and when they're sick, what can you do for them? And I say, you're going to be one of those rare people potential complications that might happens, at least you're equipped. So think about it, said, whom you also know genotype, because it just can protect you and it can also help you make informed decisions about family planning. So that's how I like to think about that.
Yeah, and that's so and what's up mentioning something like a mommy areas and trigger like another thoughts in my head, and it revolves around education, right? So you said in common as yeah, cancer about sickle cell awareness. I mean, that's part of education technically. I think sickle cell disease itself, when it comes to education for your community, and then we always blame it back onto superstition. A little bit as to why exactly is that, and what can we do to make sure, say, we create awareness within our community about sickle cell disease?
Yeah, I think the first thing is, human nature is in such a way that whenever we're presented with things that are uncomfortable, that we cannot explain, we find a way to create a meaning to it, right? And just like I explained, nipa bebree I'm on sickle cell concept and I say, and so when me know them to see who will be all sickle cell. Obi and Kansas or sickle cell, you're not going to know. This is a blood disease. So a lot of the time, I'm on sickle cell, and the biggest struggle. I'll give you a quote. One of my friends, he has this quote, sickle cell. Catch him and say, pain is the most cardinal symptom of sickle cell. I'll say, in sickle cell disease, it's not even the pain that we people with sickle cell face. That's what she said. But see, the biggest issue is people believe in their pain. That is their challenge, because obi one pain can be a 9 or 10 scale, but you're okay because what experiences are pain that you didn't know how to manage, or continue hospital doctor and say, we got all boy, new pain because you can't see it. And let's be honest, in our healthcare system, we don't have good testing to determine this is the number for pain.
Yeah.
And pain is the most common thing that these people deal with. So it makes it hard. Plus, most people affected are Black people, and I can give you historical perspective around pain and how that has been mistreated in the healthcare system. Most data showing that providers will think that Black people or people that are Black African descent have high tolerance to pain. So all of these things are contributing factors. I think about a disease that you label is typically a Black disease. A lot of the experience people are facing, and to say so, you're likely to say, hey, I'll be now sickle cell address it coming because we're so hospital now. Could do Madam I'll bet now also saying, so it makes it hard. I think these are the big reasons why in our community it's so uncomfortable, because a lot of people don't even understand what's going on, and I think the education too is young scientists in Kenya we're terrible at educating because we love scientific terms, and it's like I will explain in such a way but the people is you have to put it in layman terms for people will be mom and papa they can understand, and I don't think we've done a good job at it, and I think that it contributes a lot to it. The second part too is that superstition now it's a big issue. Basically, there's places like my foundation. We do work in Nigeria and Ghana, and I hear stories all the time. People, families, people beat the kids up. So, because they don't understand it. On TLC, say, then but no person tell say me my wo me behind me now person tell say me na me dey yare am out. And I don't think that it's even fair for people to think about it that way. And the last thing I'll say too is there's a guilt of
Mhm.
parents. They moja area me benya free and they feel guilty and they don't want to talk about it. They want to keep that kid at home because what do you mean play more until shut them and people don't know about it. I think the first step for us to improve awareness is to embrace it. Instead of me, no, because I don't live with sickle cell, and so I have no clue what it's like living with sickle cell. But what I can tell you is that I know personal stories. My sister, I can share that with you, and I have friends that live with the disease that they've gone through stuff. And I think that when we embrace that this is part of our history, it helps us even stay equipped. And
Mhm.
I think this is it. This is exactly it. You have letting people learn, letting people ask the questions, letting people say, hey, women tell you chirimu, I see no chirimu jam class, and see you crano, chirimu beam, and keeping that conversation so it becomes routine. And and I'll add to shameless plug. I think say a lot of our government and healthcare systems, need to invest money and prioritize testing. I've done some work where we look testing in the universities, testing in the high school. These are the kids that are about to transition and start dating and start marrying. I think, especially with this platform, and whom here, people. Why I have a lot of people. I have a lot of people that will text me. We say, "Hey, you people worry and we you see an yes in the chair saying," and
Hmm.
this is when they already fall in love with the person and anything like that. And then I'm saying, maybe yes, maybe I'm wire, maybe I'm person over. That's fine. But I think that if we embrace it, realize that this is part of our history, we're going to learn so we can educate each other. It helps. We have a long way to go. I'll be lying to
Mhm.
you.
Mhm.
I think these things is what starts it to improve awareness. And maybe all it takes is share one fact about sickle cell. My mom will circle me, hey, we create a day, and they ask questions. Now, there's resource, like I said, if you're on Instagram, go to at sickle cell 101, go to NOB_foundation. You can learn a ton about the stuff we put out there, and people can donate sometimes to support. Or maybe out to crown. People they need blood. People need blood trends. Like I said, their blood lasts about 20, 30 days compared to everybody else. Typically, that our bloods are lasting about 120 days. So I think awareness starts with us embracing it and finding ways to help. Maybe you're AA, so you don't have to worry about it. You can help donate blood, or you can help
Mhm.
donate to some cause that's helping these people getting the medicine they take every day. And I think that's how we take it to the next step.
Yeah, more than Juma, Dr. Bote. Oh, yeah, yeah, especially taking time out, to come here today to again highlight this important thing away your community move. So, my follow-up question to you would be, Sebi, obi was sickle cell disease. Otuminya any medical complications and now say aside from sickle cell, no, and one will be faced to the end of their lifetime.
Yeah, I love that question. I can tell you this. I think that of all diseases and conditions, right? And I know we work in the oncology space as well. I think sickle
Mhm.
cell is the only disease that it's a multifaceted complication approach. Every I said this a while back. Every part of your body that blood flows, sickle cell can go. People that have sickle cell disease, every part of your body. So if you think about it that way, moja ko your body move bia.
Mhm.
So to that effect, they can have all complications, and I think that's what makes it challenging. Into we were sickle cell, it be a moja into bones mu and they have to have surgery because they have a necrosis. It's something avascular necrosis, right? And they'll have surgery. If you need more sickle cell, they end up having strokes because the blood cannot be transported properly. Some will have heart conditions. Some will have lung conditions. Lung is a little bit also common. Like I said, pain is the most common because when you what your OPAC, and I know everybody knows if you try to stop blood from going to even your finger over time, you know the tie now that it's on side, you
Mhm.
block that even a little bit over time, it's gonna hurt. To think about these people, I'm blood vessels, because those sickle shape now shape it to say it's shaped like a banana.
Yeah.
So they're not squishing through. They block a blocky how mojanisi kona. It's not getting there. They're gonna cause pain. So I guess my answer to your question is the most common symptom is pain anywhere in the body. That's why I always tell a lot of healthcare providers I reach out. What should I do? I'm like, Listen to the patient, let them tell you they're the one living with the disease, and help manage their treatment. Some of them know, I'm pain medicine, I'm here, I'm taking this. I mean, no more, we're gonna probably pass out
Hmm.
because their bodies over time are used to high levels of pain and they deserve to be treated that way. So people, again, the stigma is, oh no, you're saying I know here because they're in severe pain. And I think that health providers can be better at that. Pain is the most common, but like I said, there's a lot more that these people deal with. I remember COVID started by no be account was some in COVID day, I bet you, and I was like, don't forget people that live with sickle cell disease. They've lived the broughts of a condition that can affect any part of the body. So that is probably what these complications are, and that's what makes the disease struggle. Some of these people live with chronic pain every day. Plus, what's any acute pain be not be tired, so and then you have to deal with that. And then I like to talk about the psychological component too, right? And
Mhm.
so
Let's talk about
stigma
that.
of that, and I think that from a psychological standpoint, that can impact pain and how pain is perceived and how our bodies respond to pain. Obi or sickle cell, they feel isolated. They can't go out to play. They might be depressed. Or they might feel like your family is not listening to them. All of those things can exacerbate every experience they're having. And I think that's why, most people with sickle cell, they're independent. I'm telling you, the strongest people you ever meet are people with sickle cell disease. They deal with a lot. They know how to manage stuff, but most of the time the stigma is barren. And the psychological standpoint, I know seeing your culture, most we don't talk about mental health, and
Hmm.
I'm unapologetic about it. I think it's probably one of the things that we could do be a little bit better. But if you look in sickle cell, the mental aspect component of it can be draining, and it makes some of those complications worse, which is why I think we shouldn't forget about that.
Appreciate it. So the other part of the question would be, say, I mean, I know, and I do understand that you are a researcher, so you might be the right person to ask this question, right? So through your research, what is, on average, the life expectancy for someone that has sickle cell disease?
Yeah, that's so. Here's what I can tell you. So let me give some numbers, right? So when you look at globally, let's start globally. So over 300 million people globally live with a trait. Over 300 million people. Let's start with that, right? And now, when I squeeze in and come here to the US typically labels sickle cell as a rare disease, mainly because rare disease is a disease that affects people 200,000 or less,
Hmm.
right? So usually you say a rare disease here, but it's not a rare disease globally. 66% and a little bit even over of people or more sickle cell live in the African region. So there is a big number of people that live with it. Why am I saying all of this? There are babies that are born every 2 minutes that live with sickle cell disease on the African continent. Every 2 minutes. Let's just sink in. Every 2 minutes, you have babies born like that. And then majority of kids that are born with sickle cell disease, especially in the regions where we are from, most of those kids, unfortunately, don't live past 5 years old. Right. So I'm telling the historical perspective now. I think it always translates to what resources are available to these people. So if you go on the African continent and you ask me through research, I can share with you that for younger kids, most of the time, because they don't have access to their preventative medicine, so they live in remote areas, less than five. If you, but I know people that are above that too. And so one of the biggest challenges with sickle cell is when scientists will or doctors will tell patients, say, hey, yeah, wait here. By the time we need 18, then right? I disagree with that. I think that it's all about what's available to these people, how they are cared for. The typical number that you would hear in literature, it will say like 30 to 40, or even sometimes less, with sickle cell in general.
Hmm.
But I always say, let's break this down. It's just a direct correlation between resources. Like I said, less than five, these kids, they need penicillin to help because the immune system is not as effective. And if you don't have
Hmm.
that, we live in a region where a lot of infections are more prevalent. Sometimes it's not the sickle cell killing them. It is the other conditions that their bodies cannot fight that's killing them too. So that's why I think that's important. I also know somebody who is 90 that lives with sickle cell
Yeah.
disease in different parts of the world too. So I think it varies, but overall, one of the biggest stigmas is that people would say, "Oh, when we do more in channel
Hmm.
and I think it's important we break that stigma and just reframe and restructure the fact that we just haven't done a good job helping these people and providing them resources. I think the better resources, which includes treatments, care, debunking stigmas, the more they can live longer to be here. But for me, I think the most fascinating thing is realizing that every 2 minutes there's a child who's born with sickle cell disease in this world.
Thanks for that. So let's talk about treatment options, right? Pharmacologically and non-pharmacologically. And I know it says sometimes within our community, I'm like, oh, OBIRM, man, ginger, man, garlic, obey okay. But let's face facts. Like Sebi, OB sickle cell disease, these things may may not be the way out. So can you help our audience understand, say, treatment options bear no more, say, yet a drama 50 doctor one as a pharmacy honum, and I say drum person way and customer you feel.
Yeah, starting from crown, I'll be quick on this one. So I know so I gave the education earlier, right, about how you inherit your blood, not trying to AA and SS. So let me give you a key fact. Say a Caribbean, when you're conceived in your mother's womb, right? That's that time when you're whatever, you already got it, right? You're not using any of those when you're in your mom's womb. And this will make sense when I'm done with the last treatment I'll talk about. There's one key part of blood. There's another component, but it could be a friend of hemoglobin F. When you are in your mother's womb, or genetic makeup a senior will be transporting oxygen in your throughout because your mom is helping you, right, with all those nutrients through the placenta and all of that. It's called hemoglobin F. Hemoglobin F, it is so strong at tied into oxygen. Into cry in your mother's womb, no oxygen moving normal. You're okay, be a cost come on. Now, you now will be now take your first breath. That is when your body says, hey, see, you're independent. So I got to activate the omamino papa de ma and kasan. And that is what's going to be say AA nalgia ODNE. AS nalgia. It's going to activate. SSI is going to activate. It takes about 3 to 4 months for that to happen. Why am I sharing that? Because most people, even in our culture, there's a lot of people, even for more money, some about sickle cell disease. No? This is how they'll find out. Or what crying baby, bounce baby, a crying energetic. 3 to 4 months, a crying come will soon in pain. They don't know what's going on. And we know several of these stories. So they'll go to the hospital. Doctor's screaming who they cause. And then I don't need you because you go check it. Crying sickle cell disease. Why is that? Because that 3 to 4 months, hemoglobin F, it's changing. It's changing to sickle cell disease, it changed to SS. So let's focus on that. To be with SSI, 3 to 4 months is when you start to see a lot of those symptoms. The most cardinal about could be a friend of dactylitis. And I wish I needed 2 words for it. I don't know. Basically, their hands and their feet start swelling up, right? Because it's kind of retaining water and it causes pain. And so for most kids that are little like that with sickle cell disease, the most common recommendation is making sure that they're taking penicillin or any form of antibiotic, right? So some of these kids are on chronic antibiotics, mainly because our immune system is not as strong as all of us and typically, right? And so they'll take penicillin to help prevent infection. And there have been studies that have been done to show this. So early in the 90s, there was a study that was done that showed that in more sickle cell, when you give them prophylactic antibiotics, five and younger, they live longer and their complications decrease. So that's a staple. A lot of kids, but even in our Ghana community, a lot of doctors I talk to, they don't even know that. And a lot of kids are not put on antibiotics to help with that. So as a kid, that's very common. Now you're going to see some parents that will give you some multivitamins because they need that. Like I said, remember, almost blood, it's lasting only 3 days. Their body is working very hard. It's a lot of kids with sickle cell more anemia, right? Because their blood cell is breaking up and they have to make new ones every time. The new ones now are called reticulocytes. They don't have enough time to make original ones. All these complicated. So outside of that, most of these kids are given chronic folic acid, vitamin B. Those things are needed to make new red blood cells, right? So you see a lot of kids giving those meds, more preventative, right? So it helps them keep and stay afloat. Now, so I know severe hospital visit BDA now they're about to put on pain medicines and other treatments and antibiotics, strong antibiotics to help them. So as kids, think about it that way. As they keep getting older, getting to the adolescent age, folic acid is still staple. Now, especially baby, you're free now. If you think about parts of the world where foods are typically not fortified, now we still get fortified foods in, let's say, our legumes and plants, but a lot of our foods are taught abontin and I say conflict, whatever you name it, those are typically not fortified in where we're from. So they need that folic acid supplementation to help in those red blood cells. One thing I want to add is aside those treatments is one of the cardinal things that we talk about sickle cells. Hey, we don't need a yellow. I don't know any yellow. I did, why is it that? And
Mhm.
it's important we educate so we know. So if you think about red blood cells now, almost red blood is breaking up so fast. There's a component of the red blood cells called bilirubin. Doc bilirubin is just one of those byproducts of red blood cells breaking down. So those bilirubin, and no, our breaking down is why you would see that yellowing of the eyes in these kids, also called jaundice. Into some will be no sickle cell, no yellow. I think it's a big stigma. There's a reason behind that because your red blood cells are breaking up so fast. So when they be put on the right measures like the folic acids, the vitamin B's, and eating healthy foods, it really helped them so their red blood cells can replenish fast and you don't have to deal with those complications. They're going to be on staple treatments. I think in our African continent, there's a couple of drugs that are approved right now. Mostly are not available. The one that's most common is hydroxyurea. That's one that most people take. Now, the reason why I explained hemoglobin F earlier is because of hydroxyurea. So hydroxy is probably one of the most. It does have its own side effects. Some people cannot tolerate it. Sometimes there might be risk in terms of even wanting to have children because you can impact that. It's actually a drug. It was a cancer drug.
Mhm.
That was it used to be used to treat cancer, but they had a patient who had cancer also had sickle cell, and they realized that that person when they take that medicine, their hemoglobin F's came back. Also, it changes, right? It goes back. Now, keep in mind, hemoglobin F's, oh my, now F now is so strong at carrying oxygen. In the cerebrum, the hypothesis on them cerebrum, it gives you high levels of hemoglobin F, and that's going to help you oxygen and will transport around. So that's probably the most common in the US. We have crizanlizumab, another drug called voxelotor. They got approved actually 2 weeks apart in 2019. So another historical reason why there's a big disparity. I think it's labeled a black disease. It's not prioritizing research. Hydroxyurea was in the 90s. We didn't see a next drug approved up until 2000s. And first one was in Dari. And then we got these two that mostly available here in the US and a few other developed countries. Back when we don't have it. And then there's more research, a lot of gene therapies being done and all of that. But I think the staple is a lot of the medicine that these people take is disease modifying, is helping them manage the disease, not cure it. And that's probably another big topic for another disease. But keep in mind, when you think about these treatments, that is why these people have to deal with a lot. And those can be expensive, right?
Mhm.
For people to take. And like I said earlier, my foundation, our goal, what we do is give these people, we focus on the ones that live in remote areas that can afford even food, give those medicines for free to them, like the folic acid and vitamin B's, because you have to take it every single day. And that's why that's important.
Phew. That's that's a lot, man. And one human being got to take all those medications and whatnot, right? Just to have some sort of stable life. So, well, I would like to also ask that is sickle cell disease a curable disease?
It is curable, but it's very tough to cure, right? So when I say there's no universal cure for sickle cell,
Mhm.
right? The most common one that we see is people go through bone marrow transplant. So bone marrow transplant, boy, guys. Long story short, when you be able to me, I a donor for you. They'll pretty much just help so that you are going to pretty much make red blood cells and any of your other cells similar to that person, and that's how
Mhm.
it'll be cured. So this, but the people have been cured from it. That process is grueling. You need pure, effective facilities. These people literally you wipe out all their blood cells and replace it with new ones, right? So there's no universal cure. A lot of people like where we're from, those things are mostly not available. Even here in the US, are barely available for a lot of people. Some people unfortunately go through it. The reality, some don't even make it. So it's just tough. And sometimes finding a match donor is another issue. That's why I encourage it'll be our only sickle cell, but you could be a donor to help somebody if they want to do a matching test that could help improve that. Aside blood donation, I'm very, very big on that, right? So blood donation is important for these people, but there's that curative option. Then there's a lot of research right now with gene therapy.
Mm.
A lot of research right now looking at, so like I explained, the disease. This is a genetic disease, right? The first molecular disorder ever discovered in medicine. Like people don't know, this is the first. and you want to tell me why the first molecular disorder only has 4 approved drugs, and you don't think it's tied to a lot of disparities, and
Mhm.
come back again and talk to me. So looking back into genetics, and you see a lot of companies now researching to see how we can correct it. Some will say, hey, we're going to take your cells, fix the error. I hate to say that, fix the mutation, and then put it back in you. Or someone will take it. One of them looks at changing that genetic component so you produce so hemoglobin F and Usano is shut down, it's shut off. Some of them are doing it where it would stay on so that you can have persistent hemoglobin and it will help you transport. So there's a lot of research being done, but as far as cure, only bone marrow transplant what staples. I've known people that have gone through gene therapy that are doing awesome now and technically being cured.
Mhm.
But it's very tough, and I think we just have a long way to go with that.
Got it. So, aside from this research number one mentioned, are there like any additional research that is currently ongoing that we should be aware of? Because I know, say, we're explaining it back in the time at penicillin, this that's a treatment, and then we evolved to hydroxyurea, and then we're now here. So, what more is currently in the market or currently under study that our audience are supposed to be aware about in terms of the option? You've also mentioned transplants and stuff like that. Is there anything else I was only aware of?
Yeah, there's a couple more. And for me, I think, this is how you would know like advocacy matters, right? If we had this conversation 3 years ago, this will be different. I can label off the top of my head some of the partners we work with, over 7 companies that are looking at different approaches to treat sickle cell.
Hmm.
There's one like through pyruvate kinase. I won't bore you with it, but yes, there's a lot of companies that are in the research phase looking at, like I said, it's a multi-organ targeted disease. So looking at what makes up our blood, where do all of these mutations happen, and how can we correct it? So there's a couple of oral therapies in development that's looking at how can we give people this drug that they can take it and it will maintain hemoglobin F? How can we give people this drug that will make sure so more red blood cells they go through blood vessels now and stick it to the walls? So there's the cell adhesion people that are doing all of that too. You have the people that are looking at therapies that's going to help target the complications. So people with stroke, how can we give them medicine so they don't get that? There's medicine that most of these people take that help them so they don't have excess iron in your blood because they have to get blood transfusions. If you take blood
Hmm.
transfusions, you get a ton of iron. So there's a lot of evolving research. I'll be remiss not to say that, but it just hasn't been great for it so much time that now it's like we're playing catch up now, right? And that's just the nature of the space that we're in with sickle cell, and it gets me excited to see it. Some have failed. I'll be honest and say that
Hmm.
some research have failed, and I think it's just one of those most um, interesting diseases that all these researchers are working on. My hope is eventually we get to a point where all these treatments that we're seeing, most of these we're talking about, is here in the US. It's usually here and extrapolate out there. We can get to a point where we can do more trials, more research in our communities and start over. I advocate for a lot of that with my research where I can pull in more partners, hopefully, a global scale, work with different governmental organizations in Ghana, Nigeria, you name it, so they can do more research. But it's exciting. It's exciting to see all these different therapies. It's just that some of these people, unfortunately, might not be here when these are available.
Yeah, unfortunately. All right. So the question number one more sana edi enkomo na baby, I know say you enkomo na sano. You've kind of like explained phenotypical traits, right? Why explaining say your body, saying that your knee color, then. You've explained that like these are things that we see. So now, can you also explain like I didn't think that was say, yeah, encouraging comfort to know almost sickle cell genotype.
That's a great question. So, send them share earlier. I said they're kind of the most common one, and I'm not sharing, right? Genotype is what will tell you, say, hey, me or A, me or AS, me or SS. Those are the typical, right? Now, the way that our genetic setup at here where your body mono is there's different variants. So there's people that are more sickle cell their genotype is SC. In Georgia, S back free in my no G C back free. Ne papa, you're like C then a C the kunya for him. It's just varying copies. There is F components, there's the D's, there's the E's, right? And so these are all ways that, like I said, our bodies are just so unique at evolving. So it's going to create all of these different types. Now, what I'll tell you is in sickle cell, the one that has the most severe complications and the most like worse outcomes is usually more SS. No,
Mm-hmm.
you're going to see varying things too, where it will be on more SS. The symptoms in less severe compared to be over SC. So I think it's important that people know their genotype. One, because it can help you make informed decisions about your health. But two, you might be carrying another some of these rare ones I talk about, C, D, E, F, you name it. And you didn't even realize that. And even if the sickle cell trait now, we can trait the most common is AS. AS right? But there's C trait, and I can nerd to you guys all about it. And so that's why I think it's so important that people know their genotype. Now, the last thing I want to add is most people confuse genotype with blood type, right? So guys, because could donate blood, me AB, me O say O positive, O negative. Those are very different, right? And so knowing your genotype, I think helps. Sometimes people can know, because me AS, no, me sickle cell trait, because AS the only thing could donate blood. But now that I know, there's actually evidence that shows Omomo is they can still donate blood. Who donate more general? It's not just the blood that's being used. They can use the plasma of the different components too. So that's why I think it's important. You have to know your genotype so you can be prepared to say, hey, does that mean what? At least minimum partner in need. Whereby be a babinya sickle cell no nya. At least we're well prepared. Two, I talk about the potential complications that sickle cell treatment will have. Then all these variants now make one say one person could donate blood, be a boob, or sickle cell. At least you know, and they can figure out what way to benefit you. And I hope some of our governments and a lot of organizations that have the funds and resources can help provide free testing. I think that's probably the biggest part. But that's why I think it's important people know. It's hard to tell people to go find out what's within you versus find out what's outside. It's instead of me catching mommy say, hey, call your physical mommy.
Mm-hmm.
Took me almost 3 months to convince my mom to go to a physical. But my mom said, let them tell me, they want to treat it right now. So that's why I think we have to keep talking about it to remind people. So maybe because we're inside out. I tell a lot of people, like people with sickle cell, say, the reason why I tell them to, hey, go check up, and they say, a lot of times they're also inside. By the time I'm outside, now it's too late. Right.
Correct.
And so it's like you have to just give yourself a reminder to go find out what's in there. Just know for the sake of knowledge sake, and it can help you just stay informed and help other people too.
Yep. And that's it.
Yeah.
So Dr. Wharton, you're the community baby, so no one spending on us today, educating us about again uncovering sickle cell disease and sickle cell trait. And so the community baby, person who said, do you have anything else to highlight in terms of the most important key takeaway message for being in Bono? So the audience, the BTS said, sickle cell disease, don't rule yourself out. These are the options for you to account.
Yeah, no, I love that. I think for me, the biggest key takeaway, so what they want to be free and not. One thing I want everybody to know is sickle cell disease is not sickle cell trait. That's the first thing I want everybody to know. Those are two different things, right? And the second thing is everybody should remember says sickle cell be or sickle cell disease or so be or sickle cell trait or so be a only mubiao. It's an inherited blood disorder. It's not a curse. It's not something that will be near or something like that. Those things are important. The third thing is that the known factors of most sickle cell disease, they have to deal with a lot, and treatments are not really that great for most of these people. I always say just be kind to these people. You never know what someone is going through. Be kind, and if you have the capacity to help, you should. I talked a lot of my foundations. It's not the only people doing work. There's a lot of organizing in Ghana, in Nigeria, all these places are more amazing work. Find those organized, volunteer for them. Sickle Cell Awareness Month, September. You can go on a walk. You can go donate blood because and then this month they met donate. We'll take donations from our foundation, but it shouldn't be just us, right? Help somebody which means be free folic acid and vitamin B. I think those things are important. And the last one, shameless plug: know your genotype. That's okay. So just know it. One, if you want to have kids, you can make an informed decision. Two, we're doing a lot of research, a lot of evidence that have shown these rare complications can happen. If people want to know more information, like I tell people, you go to www.sc101.org. We have a lot of information there. You can go to www.nobfoundation.org. A lot of information about sickle cell disease, sickle cell trait, you name it. These evolving research is still going. I did a study. I have an ongoing sickle cell trait study that showed that or more sickle cell, whether sickle cell trait, not sickle cell disease, over 70% of those people can say, or more parents, no more genotype. A lot of people are having these kids they don't know. So that's a lot I want to encourage everybody. Just know your genotype, and it's okay to ask questions, right? That's why we're here, to be a resource. And I'm just glad that we can have this conversation, and happy Sickle Cell Awareness Month to everybody out there. So thank you. Thank you for having me today.
It's our pleasure. It's our pleasure. I mean, we really appreciate you coming through today. I know you have a packed schedule, but taking the time out to again educate our audience specifically about this subject means a lot to us. And I'm definitely looking forward to a next or subsequent series about this, being that this month is about celebrating sickle cell awareness. So maybe viewers, this is your chance to again go through it, review the thing. Beside any questions we all Nyambwa say Mubisa your questions say best have a back and address all your questions number one in our next recording. That I'm saying to you very soon. Bye bye.